Hey, thank you so much, Lila, and welcome to everybody. Thank you for taking time out of your, what I'm sure is a very busy day, to attend this Nourishment webinar. And we're going to be talking about the plight of the veteran and also, honoring our heroes. And I thank you so much again for attending. Sorry we had to postpone it from last week. We actually wanted to do it last week because that was around Veterans Day. So we did have a very nice Veterans Day celebration here for our patients at Sierra Tucson. So anyways, my name is Bill Reynolds, and I am the director of the Red, White, and Blue program. And for those of you that don't know, the Red, White, and Blue program is a program that is specific to veterans and first responders here at Sierra Tucson. We started it about 4 years ago, and originally, we would have mostly law enforcement officers and mainly some people that came here for other reasons but happened to be in the military. But the program has really taken off over the past year or so. We are now in network with Tri-West, so we have a lot of people that are getting referred from the VA, which is phenomenal because we all know that the VA, wow, lots of veterans coming back from from Iraq and Afghanistan, and I think that they just can't get the services that they need. It depends upon where they're at. So the VA has an agreement to provide services out in town, refer to civilian facilities if they can't handle the situation. So anyways, it's an honor to do this job. I also am a former Navy guy. I was in the Navy for 30 years in my former life. I got out in 2012, spent that 30 years in Navy medicine, and also got to spend time with the Marines, on submarines, ships, got to do some cool stuff. And also to include fun places like Iraq. So anyways, what I'm going to do is I'm going to go ahead and turn off the camera, and I have just a few slides that I want to go through. It's not too painful. I think I'm going to do a lot of talking while we do this, but what we're going to do is look at some of the macro issues that are affecting our vets right now, big picture type things, and then towards the end, we're going to talk about some resources for you. So. Okay, so when I talk about the plight of the veteran, that implies that there's a struggle, and it doesn't necessarily apply to all of our veterans, right? But it's just important to remember that we're just now, within the past 2-3 months, the United States has gotten out of Afghanistan, and we were there for 20 years, and we still have some troops in Iraq, and not very many compared to back in the early 2000s, but it's been a big stress on the military, and that's what we signed up for, right? But that doesn't mean that it hasn't taken its toll. So for example, when I deployed with the Marines to Iraq in 2004, the Marines are pretty good about keeping deployments to 6 or 7 months. However, the Army and the National Guard, they often do year-long, sometimes 18-month deployments to combat intensive environments. So you have people that spend a lot of time over there. They're exposed to significant amounts of stress, and then they come home for a little while, and then they start the cycle all over again. So, anyways, there's definitely a population in need, and we're going to look at some of the risk factors or some of the big problems that are affecting the vets right now. So, one of them is homelessness. This is the first one. This is really interesting because you would think that somebody that comes in the military and they do their time and they get out, they go back home to a happy home and live their life out, right? Well, that often is not a case, and it's especially true, as you can see on the slide, if they have a low socioeconomic status, mental health disorders, and of course a history of substance misuse. And the trauma and the co-occurring disorders and the substance use is a lot about what we're going to be talking about today. You can see the resources there. We always say the VA, and the VA does have incredible amounts of resources. I think it depends upon where you live, though. Somebody I work with, she works at the VA. She says, if you've seen one VA, you've seen one VA. And what that means is some of them have fantastic services and others not so much. So anyway, so anybody that serves in the military, that is a veteran, they are at higher risk of experiencing a TBI, a traumatic brain injury, as well as post-traumatic stress as compared to civilian populations. The TBIs typically, I mean, we could do a whole topic on TBI alone, but we do know that For somebody that's injured on the battlefield these days, if a Black Hawk helicopter is able to get to them relatively quickly, they have a 98% survival rate. And this is a double-edged sword, because a lot of these injuries that our troops suffer from are pretty horrific. And I've met more than a few veterans that wish they had just died on the battlefield, because they're now living with chronic pain, significant disabilities and whatnot. So, but the TBIs are multifaceted. Most civilians suffer, like a concussion during at some point during their life. But in the military, there's mild, moderate, and severe TBIs. So what we have is a lot of the veterans that have been exposed to improvised explosive devices, they develop chronic post-concussive syndromes, and this can be manifested by irritability. They lose that frontal lobe, sort of restraint, where they prone to anger outbursts. They can behave inappropriately. They have poor judgment. They can have, headaches, tinnitus, which is ringing of the ears, insomnia, and of course you throw in the depression and the nightmares from the trauma and everything else. So anyways, the TBI is a very, very significant risk factor for homelessness. There are 4 or 5 centers across the country that deal specifically with TBIs, and the VA has done some amazing research in this area. But it's definitely, it can be, it's a big thing for homelessness. There was actually a study that was done in 2015 of veterans that were going on medication-assisted treatment for, to be on methadone or Suboxone for opioid use disorder. And this study identified the fact that the prevalence of homelessness in vets that struggle with opioid use disorder is 10 times more than the general veteran population. And it's not uncommon for people to be seriously injured overseas, and then they come back and they go through rehabilitation, physical rehabilitation, often get started on opiate pain medication, and then of course that ultimately comes to an end, and they can't handle the pain. So many veterans have turned to heroin, IV heroin, fentanyl, whatever they can get off the street. So anyways. And the other thing that's really important, and I guess a key demographic that's different with our current veteran population, we have a lot more women that are serving in frontline combat roles. I remember when, sort of take it for granted now that women serve on aircraft carriers and ships. It was in the early 90s when this happened, and to me it just seems like women have been doing that forever. But what is newer than serving on ships is our women that are going to the front lines, in support roles. There are some women that want to serve in infantry roles. I'm not actually sure if that's happening or not, but they're exposed to a lot of the same dangers that your regular Marines and Army folks are. So unfortunately, there is something called military sexual trauma, which is becoming more and more identified, more and more, I should say, acknowledged by the Department of Defense. Personally, it makes me cringe to hear that women that suffer that, typically women, some men as well, but it's, the experience of sexual trauma also can definitely increase the risk of homelessness. And, I think it's always been acknowledged to some degree that sexual assault in the military has been around, but, given the culture of the military, I mean, it's been ignored. And it's kind of overshadowed by other things such as post-traumatic stress, extended separations from loved ones. So we do know that the vast majority of military sexual trauma is actually not reported, sadly. And why is it not reported? It's because there's fears of retaliation. It is a male-dominated culture. You have women that want to come in and they seriously want to serve. They want to do their part. And, if they think that their career is going to suffer because of that, they're not going to report it. So that results in people, and women and men not getting the care that they need for the sexual trauma. The reports of military sexual trauma have increased by 88% between 2007 and 2013. That's a significant number. So I think, traditionally, although it hasn't been disclosed, I think some women and men are becoming a little bit more open about disclosing sexual trauma they've suffered, and the VA certainly has recognized it. Everybody that goes to the VA is screened for military sexual trauma, but it is felt generally less than 15% of people that are victims of sexual trauma do report it. So just another side note on the women that suffer sexual trauma, they are 4 to 9 times more likely to suffer from PTSD compared to female veterans that do not have that history of sexual trauma. So anyways, I here at the Red, White, and Blue program, I've had more than a few patients that not only have had, you know, exposure to combat and whatnot, but they're also struggling with sexual trauma. So let me see, what else? The other thing is when veterans return to civilian life, their support network is really important to take into consideration as well. There are some people that when they get out of the military, they don't really have a strong social support network. So they're really going home to not much. And they also can have skills in the military that don't easily transfer to civilian life. So anyways, we talked about making that transition from the military to the civilian environment. I remember when I was getting ready to get out in 2012, I had to Google what business casual was. I'm not kidding. I had no clue what that meant. So, you know, you get used to wearing the uniform for 30 years or, you know, 20 years, whatever. It can be a bit of a struggle. So the other thing, you know, one of the things affecting unemployment for veterans is as of last month, the unemployment rate for vets increased to 5%, which was up from around, I think it was 3% the previous month. There's around 600,000 unemployed veterans as of the last year. Over half of those were you know, the normal kind of standard range of ages from 25 to 54. Only 40% were older than 55, and only 5% were, you know, 18 to 24. So, you know, there can be a big transition going from, you know, being a tank mechanic in the military to trying to translate into, you know, that kind of work into the civilian sector. So, for example, I was a submarine independent duty corpsman at one time, right? Well, there's not a big, you know, calling for submarine medics on the outside. So the military does have programs. There's a program called the Transition Assistance Program that can certainly help people formulate resumes and translate their military specialty into civilian kind of work, but that doesn't always, you know, there's not always like an equivalent with that. So if you're struggling with substance use and also post-traumatic stress on top of that, I mean, finding a job as a civilian can certainly be, you know, overwhelming. Some interesting things that there are some factors that predict a easier reentry into civilian life versus more difficult. And here's what makes it easier. People that have college degrees, that are college graduates, people that understood the missions and were well educated around the objective that their unit was on. Officers are typically more educated than civilians, sort of on average. And then also people that had strong religious beliefs were identified, you know, as that being very protective for them as far as making the transition into the civilian world. Now, here are the things that make it difficult. People that have experienced a traumatic event, people that were seriously injured, anybody that has served since 9/11, it has been more difficult for them. And if they knew somebody that was killed or injured. So those were all the risk factors that can make it more difficult to transition into the civilian world and be unemployed. There's actually there's a big study done by Pew Research on that, if you're interested in looking that up. So, okay, so this is really kind of the bread and butter, what a lot of veterans struggle with, and this is mental health and substance use disorders, right? So this is an older slide. Obviously, it only goes through 2009. At that time, Vietnam vets had eclipsed post 9/11 vets, but now I am quite confident that the numbers post 9/11 are significantly greater. And these are numbers of people that have service-related post-traumatic stress. So whenever anybody gets out of the military, they do have the opportunity to seek services with the VA and file claims for injuries that they may have suffered on active duty. And this ranges from like sleep apnea all the way to, you know, post-traumatic stress, military sexual trauma. You know, a lot of people suffer musculoskeletal injuries. So the VA is very backlogged right now handling those claims. But anyways, my point is there's a lot of people out there that are getting service-connected disability for PTS. It's estimated around 20% of people with PTS also have a substance use disorder. And also about 30%, 33% people that go into treatment for substance use disorder also has post-traumatic stress. In my experience, by far, alcohol is the drug of choice for our veterans. Heroin, opiates are in second place with that. And what's interesting, and I talk about this a lot here, but less than 1% of veterans receive an isolated diagnosis of a substance use disorder without any other co-occurring disorder, right? So, it's my term for the trauma, which is often unacknowledged, is the fire in the basement, right? Because I've had more than a few people come into treatment and they have been in treatment for substance use several times before. And as I'm going through and getting to know them, going through their chart, I say, well, you certainly have a lot of trauma. What did they do for you at that last treatment center? And the answer is typically, oh, they say they don't do trauma. So anyways, that certainly justifies that statistic. So less than 1% of vets have an isolated diagnosis of alcohol use disorder or benzo use disorder, whatever. There's usually something lurking in the background, right? So that's one of the things that we're proud of doing here. Certainly in the Red, White, and Blue program is we look at the whole person and make sure they get that trauma treatment. And a lot of veterans that have come here, although they have had trauma in the military, they also had significant developmental trauma before they even went in the military. So many of the vets choose to focus on childhood sexual abuse, childhood physical abuse, emotional abuse, things like that. So this is just a big picture slide. This was as of 2014, had over 23 million veterans. Obviously, the number is higher than that now. Substance use disorder, actually, it correlates with the national average of civilians. It ranges anywhere from like 13 to 15%. And again, you can see here that alcohol is the big ticket. It's easily accessible and socially acceptable. And that's what people in the military, they do, because if they do use illicit substances, they invariably will get caught on a urine drug screen. Probably the most common substance I saw when I was in the military, people getting kicked out, was the use of marijuana. And so anyways, alcohol, heroin, and marijuana, those are the big ones. This is just talking about here, when people have trauma and there's a stigma to begin with to seek treatment for that trauma, they like to self-medicate, right? We all know that. So, nobody wants to live with not being able to sleep or with nightmares or that hypervigilance, that hyperarousal. So alcohol is again the go-to medication for that. More and more heroin and opiates, as I've also said. And it's interesting because in this population, there's such a stigma with asking for help, right? Because we're taught in the military, we're taught to be self-reliant and you suck it up and you're a tough guy. And it's females are taught the same thing. When my last duty station was in Hawaii, I remember walking around base and you would see posters from the chief of naval operations that said it's okay to ask for help for post-traumatic stress, which is fine. It is encouraged. But I've never met the chief of naval operations, and most people haven't. And what it comes down to is what I call the deck plate leadership. It's the person in charge of you that is going to encourage you to do that, or they are often discouraged from doing that. I can tell you my experience being with the Marines. The last thing any sergeant or corporal wants to do is lose one of his troops, one of his Marines, to treatment. So they'll say, typically, if you go to a medical for this, I'm gonna make your life miserable. So, anyways, that's certainly a big problem as well. This is just something I came across. We've all heard about the seriousness, the prevalence of veteran suicides are going through the roof right now. This article was just, from a few days ago. Suicide rate in amongst veterans in Ohio, twice that of the adult population. And you hear the number like 22 veterans a day, which is, kind of on average. Those aren't all post 9/11, although I think the majority of them are. We know that in successful suicides, around 30% of completed suicides were preceded by alcohol or drug use. So it's a significant problem. And I know the VA and the military has really done an exceptional job in educating people. There's crisis lines, there's people you can call 24/7. But so often people that are suicidal, what do? They isolate and they use substances, and there's just that, again, that stigma of asking for help. So these are just resources available to veterans. You've heard me mention the VA quite a bit. Again, there's that that hypermasculinity, that stigma. In a perfect world, integrating substance use disorder care into primary care, like screening for that more consistently, like I think we do fairly well for depression. I think it's kind of hit and miss as far as screening people with substance use disorders. And again, it comes down to military veterans. They're just more likely to want to, solve it on their own. They'll say, well, I'll quit drinking on my own. Many people are even reluctant to become involved in AA or NA. And there's also an element of wanting to protect their family, right? They think they're protecting their family by continuing to use substances, but, not asking for help. So again, it's that sign of weakness. This is just something I put up there. This is not a risk for, this is not really a plight of the veteran, but I did want to highlight that the post 9/11 veterans have a wonderful GI Bill package. And if you look at the number of college graduates, it's remained fairly consistent compared to non-veterans and veterans. The military has done a good job of having programs like they have tuition assistance programs that will help you pay for college. And then when people get out of the military, they have a significant college benefit. I don't know what the number is right now, but it's very cool, very good, a good thing. That's what I'm trying to say. All right. Now, what I want to do is I want to talk about resources. I don't know how many of you deal with veterans on a regular basis. I know that people that live in more remote areas, it can certainly be difficult, if not impossible, to access a local VA. But this is just a website. It's called Salute to America's Forces. And you can Google, if you type in Google military assistance, veterans, there are a plethora of resources, from substance use disorders to like financial assistance. Like the Gary Sinise Foundation has done a wonderful job in assisting vets that are really down on their luck financially. I mean, they have paid off people's mortgages. I mean, it's just, I think the recognition for the veterans and wanting to help them is out there, but it can be kind of a confusing path to navigate. So this is a good starting point in my experience. Again, it's you'll have this reference on the handout when we're done with this, but this can be a good start as far as a veteran asking those questions. And one of the biggest resources that we have, this is again from that page, I'm sorry. One of the biggest resources, if you have not heard about the National Center for PTSD, I highly encourage you to check out this website. This is one of the most comprehensive websites to help veterans. It's not just for post-traumatic stress. It's a wonderful website for patients as well as clinicians. And, there's, for example, they have a consultation program. Like if you have a patient that you have questions about and you're not sure like how to navigate their care, there's actually a PTSD consultation program. So if you go to this website, you type in the National Center for PTSD consultation program, you can talk to a provider and they will give you guidance. This also has a bunch of, in addition for providers, it's also obviously for the vets, there's a bunch of wonderful apps that are recommended, like there's apps for sleep, right? Because we know that the number one, the recommendation, the gold standard for sleep is not a pill, it is CBT, right? So there's an app to help sleep. It's called CBTI for insomnia. There's one for COVID. There's one for post-traumatic stress. There's one for depression. And these are apps that you don't even have to be a veteran to use. You can use this in your regular, your regular practice. So it's just a great resource. And some people out there, you may be uncomfortable like dealing with the military sort of culture, like there's also even a link on here where you can learn about oh gosh, I'm thinking of to become proficient in their language. The saying is escaping me right now. Cultural competence. You can actually go there and check out, get some tips on how to deal with military veterans. So it is just a wonderful website. It also talks about traumatic brain injury, substance use disorders at length, and various resources. So I'm sorry, I keep hitting this by accident. I'm going to turn my camera back on. And we have some time for questions if you wish. There we go. Okay, thank you very much. Let me pull up my questions here. Okay. All right. That is an awesome question. How is one of them is how is the VA taking care of military sexual trauma? So again, I think I mentioned it earlier, is people that when they engage with the VA, there's actually a very comprehensive screening questionnaire that they go through, and they ask, have you been a victim of military sexual trauma? And they actually have specific resources across the country. There's an actual program, a very, very big program, sort of a subsidiary of the VA that deals solely with this issue. And you can get plugged in not only for treatment recommendations in your area, but also many vets want to file for service-connected disability because of this. So I would recommend, again, if you're not near a VA, I mean, we want to do our best to try to find therapists and providers that may have some level of cultural competence in working with veterans. I mean, I think that goes a long way with our patients, is, you know, sort of understanding their background. But I would start at that website that I just talked about, the National Center for PTSD. There's a whole section on that. And by the way, there's also a bunch of very good training videos on that website as well, you know, like PTSD 101, and it's very, very comprehensive. It's a good website. Let me check and see the next question here. So somebody just asked again about the cultural competence. They work in an area where there is no military bases nearby. I would, you know, if you have, I mean, even if you have one or two military veterans as a client, I would definitely recommend going to that website, and you can get some tips. There's a bunch of educational resources, military cultural competence. There's entire websites dedicated to this. And also, when we're done here, I'm going to have my contact information. If any of you want to contact me individually, drop me an email or call me in my office. I would be more than happy to talk to you at any time about questions you might have about, you know, your military clients and how we can help. So I think that is all of the questions that we have right now. So I just want to thank you again so much for tuning in. I know that you're all busy. I want you to consider CR Tucson as a resource for, you know, the veterans. We, you know, not only is it me that, you know, is doing the Red, White, and Blue program, I have a small staff of former veterans and or first responders that are pretty savvy in dealing with this population. And I'm more than happy to help. Again, the VA, the squeaky wheel gets the grease, so to speak, in working with the VA. Sometimes if you have somebody that really needs to come into what you feel is, you know, is residential treatment, each VA has a community care network that your veteran needs to engage with. It's called the CCN. Again, that's called the Community Care Network. They are authorized. They're not just CR Tucson. There's various treatment centers around the country. I would recommend choosing one that is savvy working with vets, because the camaraderie and the unit cohesion is everything to veterans and first responders. So anyways, thank you again. It's been my pleasure, and I hope to hear from some of you soon. Thanks. Have a great day.